What makes Feinberg's curriculum really unique, I think it's a combination of the breadth of experiences that you can get in your preclinical years and clinical years, combined with all of the amazing mentorship and support.
When I visited and got to learn more about the curriculum and the opportunities here, whether it's research or the diversity in the curriculum, the classes that we have, I think that was what really allured me, and also the sense of community really drew me in.
Feinberg's curriculum is very intentionally and deeply integrated. Our students are exposed from nearly day one to longitudinal patient care, what it means to work in teams, so that our students are ready when they hit residency to be at the forefront of how medicine is evolving at the bedside.
The best part about Feinberg's curriculum is early clinical experience. I think that has really prepared me for third year, for my clinical experiences, knowing how to take a history, knowing how to talk to patients, to walk through these encounters early on.
Students begin working with patients through the education-centered medical home about 2 months into their curriculum, which allows us to really put into practice all of the clinical aspects of their curriculum that we'll typically learn for the first time in the classroom.
Being able to build those longitudinal relationships so early in medical school has been so impactful. As your knowledge builds, you get to bring more to every patient encounter, which is so real for the real world of medicine. We're always learning as physicians, even now.
Longitudinal relationships are really a cornerstone of our curriculum here at Feinberg. Many of these relationships are some of the most meaningful for our students during their time here.
I can't speak enough about how kind and compassionate and supportive the faculty here have been, and I really experienced that and felt that from day one.
Students have longitudinal relationships with their college mentor, the continuity clinic preceptor in their education-centered medical home, and within the area of scholarly concentration, students have a longitudinal mentor that really acts as a guide as they're developing their skills as a clinician researcher.
What's unique about the curriculum that I really love is AOSC, which is the area of scholarly concentration. Coming to Feinberg, where there's such structure and a love of science and research, is what has been my favorite part.
The framework of having a mandatory research project is a really useful tool as a student to get the opportunity to interact with faculty and talk to people whose research interests align with yours.
We have things known as threads in the curriculum, so we learn everything from health and society to machine learning and digital health, all the things that are going to be important for the frontiers of medicine and will really allow us to integrate that knowledge into our practice as future physicians.
One of our absolute strengths, and always has been, is our curriculum in evidence-based medicine, where we teach students not just how to ask questions, but also how to look at the literature and the data, and now the AI models that are producing information for physicians at the bedside.
We've also launched an innovative leadership curriculum, which is designed to equip students to develop the skills necessary to develop their full potential as leaders, whether that be in their institutional leadership roles or within individual clinical teams.
What drew me to Feinberg was really the location in downtown Chicago and the abundance of community opportunities to engage with the surrounding area.
Our students have the opportunity to train in a wide variety of clinical care settings. That gives them exposure to a wide diversity of patient populations, diseases, and most importantly, the way varied healthcare systems deliver care. I can't imagine a better launching pad for their future careers in medicine.